The reality is not everybody really understands what it is that our members do and the difference they make in people's lives.
More than anything else, I think we are guided by our regulations. Most of our patients probably have at least 12 meds. You know, they have antihypertensives, they have something for cardiac disease. There are so many comorbidities. The nursing staff in a SNF needs to be like a med-surg nurse was 10 or 15 years ago.
We know from CMS that the payment drives the care. You know, CMS changes from fee-for-service to a PPS, all of a sudden we shift how we provide care. You know, instead of constantly saying to the government, don't take this from us, don't take this from us, come to the table with a real plan. We're the experts in this. We do this better and we know this industry better than anyone else. We shouldn't be letting others tell us how to do it because they're not going to get it right.
So much of what we're doing these days, we're dealing with massive regulations, we're dealing with all new payment models. We're trying to blend that between the various sectors of healthcare.
They see those 6 million Medicaid days and they see those 1.3 million Medicare days, but maybe they don't understand that behind every one of those days is a person providing care to a person in need.
We've had a scenario this year where we've had more change thrown at us than we've ever had in history. But at the end of the day, we got to keep fighting. And you fight each and every day to protect and care for the residents that you serve. And guess what? We're here in Washington doing the same thing. I know one thing is for sure, and that's that you're overburdened. And it's important that each of you show up and convey the message to your members of Congress to ensure that they respect and understand what we do.
The association is here every day in Washington lobbying on our behalf, but I think whenever the legislators hear from us, it carries more weight. It's actually more grassroots. I think it has more meaning.
When I watch the posture and the faces of the congressional folk and they start to hear the realities on the ground at the bedside of, in our case, of the Nebraskan that's giving the care, I'm telling you, it's making a difference.
The experience of coming to the congressional briefing, it wasn't just going to the Hill. It was a session beforehand, resonated to us that our story is important, and so you felt empowered.
I learned so much being here with my colleagues across the country that provide the same type of care, but in very different settings.
People really underestimate the innovation that's occurring in the post-acute setting. Truly cutting edge, life-changing, caregiving results are happening every day in a post-acute care setting. And taking a patient who had been determined by an acute care setting that they'd never eat again, a ventilator placed in them and sent to a skilled nursing facility. And we look at them and say, this isn't the end, this is just the beginning.
The work we do every single day is sacred work. And I am so passionate about ensuring that our congressional members really know this. It's one thing going in saying we need money. It's another going in to say that, you know, you've got some regulations that are affecting us. But they need to understand the importance of the care we provide.
Tell the story of our members, to tell of their important works, of their caregivers and the changes they make.
We are the connection from the hospital to their home. We get them better so that they can go home and go back to their life and live a full life.
People need to understand what our seniors are dealing with today. We are delivering quality care to our seniors, and we can prove our quality through our quality measures.
At the end of the day, our business is about people, and it's people serving people. We're here to make an impact, and we're finding solutions to get there.
We're stronger together.
You're counting on us, and we're here.
Together, we are the solution.